Good morning, everyone. My name is Tom Burke. I am the president of St. Francis Hospital, a member of Trinity Health of New England. Today, we are proud to announce our partnership with Hartford Public Schools to provide local educators and staff members with the COVID-19 vaccine. To kick off the first wave of vaccinations, 1,500 educators and staff within Hartford Public Schools will be receiving their vaccines over today and tomorrow at this pop-up clinic here at St. Francis. Thank you, Dr. Leslie Torres Rodriguez, for your leadership and cooperation on this initiative. We are grateful for your partnership in this critical mission that is so important for our community. Thank you to Hartford Mayor Luke Bronin. We are grateful for your continued leadership in securing these incredibly important partnerships. And thank you to Governor Ned Lamont for your dedication to the residents of Connecticut and supporting our vaccination efforts. I'd also like to thank the dozen volunteers from the Connecticut Air National Guard who are with us here today. I would like to express my sincere gratitude to our St. Francis Hospital colleagues who have once again stepped up to the plate to provide this special pop-up clinic to our local educators. On the other side of the campus, our colleagues continue to work tirelessly at our St. Francis Vaccine Clinic, as well as the neighborhood clinics we launched at Parker Memorial Community Center and at the South End Senior Wellness Center. You all live our mission and core values day in and day out, and I cannot express enough thanks for all you do. We are also proud to share, yesterday, St. Francis assisted in the administration of 500 vaccinations to Capital Region Education Council educators at the Academy of Aerospace and Engineering in Windsor. Thank you to our Trinity of New England leadership team for your continued support and enthusiasm throughout the ongoing pandemic and vaccine distribution. It is part of our mission to serve as a transforming and healing presence within our community. We have a wonderful relationship with the Hartford Public Schools, and we are thrilled to work collaboratively with the City of Hartford to bring COVID-19 vaccines to our educators. We look forward to furthering our effort in ending this pandemic, and this includes keeping our teachers and school staff and our children safe. We are proud of our work to put the words of our mission into action. It is why all the individuals inside are here today, and they're here every day. It's what we are called to do. We will continue to collaborate with the city and with the public schools to ensure our local educators are vaccinated and able to continue providing for our students in a safe and healthy way. And for me personally, as a father of 3 elementary school-age girls and the son of a teacher, I have the utmost respect for our educators and applaud all you have overcome this past year while continuing to engage, enrich, and care for our children, our students. On a personal note, I'm looking forward to spending some time in the clinic administering vaccinations today. And again, I just want to thank all my colleagues who are volunteering their time at this important event. So thank you, and I'd like now to introduce Ms. Patty LaMonica, our Chief Nursing Officer. Patty?
Thank you, Tom, and thank you all for being here today. Thank you, Tom, for your continued leadership on this incredible effort, and Mayor Bronin and Governor Lamont for joining us today, and thank you to Dr. Leslie Torres Rodriguez. We are so proud to partner with you in the Hartford Public Schools in order to get more COVID-19 vaccines into our communities and to keep our educators, students, and neighbors safe and healthy. I'd also like to thank our incredible vaccine clinic team at St. Francis Hospital and across our Trinity Health of New England organization. Since our first shipment of vaccines arrived, we did hit the ground running, opening our first clinics in mid-December. I'm proud to share that to date, Trinity Health of New England has administered over 63,000 vaccinations. At our St. Francis Hospital clinic alone, we've administered over 30,000 vaccines to date, thanks to our team who have worked tirelessly to operate smoothly and efficiently for our patients. Also, my heartfelt thanks goes to our vaccine team leadership, and just to mention a few, Dr. Phil Rowland, our Chief Medical Officer, Tara Falsetti, our Interim Director of Pharmacy, Amanda Safer, Director of Nursing Education and Practice, Ashley Dickinson and Kayla Bennett, RNs, Bianca Matthew, Director of Finance and Operations, and so many other incredible colleagues and community members who volunteered their time to make sure our clinics are the best that we can do and in Connecticut. From registration to observation, administering vaccines and all of the behind-the-scene work to set up and make our clinics run. Our colleagues have stepped up across the board. I cannot express enough gratitude. So many of our extraordinary colleagues have been involved in the top-to-bottom operation of our vaccine clinics, including our hospital president, Tom Burke, who you just heard, who got certified actually to administer vaccines, and he will be doing that today and tomorrow at this clinic we're currently running. Throughout this pandemic, we've faced many hurdles again and again, but we at St. Francis are proud to continue to rise to each and every challenge and carry out our mission. Thank you all, and now I'd like to introduce Dr. Leslie Torres Rodriguez, Superintendent of Hartford Public Schools. Thank you.
Good morning.
Good morning.
Good morning. It is a very exciting day for us at Hartford Public Schools. Thank you for being here this morning, and I'd like to begin with some gratitude. Thank you so very much to St. Francis Hospital, President Thomas Burke, all of the health partners that are here today, Trinity Health of New England, CEO Dr. Edie, and everyone else behind the scenes that's making today possible. When we think about equity, I'll talk about equity. This here is an equity move. So before I do that, I also want to thank Mayor Bronin for your leadership and partnership, and also our governor, Governor Lamont. We know that when we closed schools almost a year ago today, our schools changed forever. We know that we had to, at the drop of a hat, figure out how to make learning accessible to students in a way that was equitable. And we know that we still are trying to figure that out, knowing that some students cannot access their best learning. So today, what we're doing here, today, tomorrow, with the vaccination clinics, that is an equity move, because our students will be able to get back to classrooms where we know they can access learning the best way possible, where we know that they can have access to the resources, social and emotional and academic supports that they need. And so moving forward, I look forward to getting our students back in safely. So vaccinations coupled with the health and safety protocols that we have been implementing since the beginning of the year will allow us to do that. We're looking forward to hearing as to when the next set of vaccinations is going to be available, knowing that we've prioritized our pre-K-5 and pre-K-8 schools because they had the largest number of students in person. And just this Monday, we welcomed back about 7,000 of our hybrid students. So they're in our schools every single day. And as the weeks continue to progress and vaccinations continue to become available, we will have all of our students back in our schools later on this spring. So I thank everyone here for their partnership, and I look forward to the work ahead as we get students back into our classrooms. And now I'd like to call up our partner in all of this work, our mayor, Luke Bronin.
Thank you so much, Superintendent. Thank you to Tom Burke. Thank you to Dr. Edie and the entire team at St. Francis and Trinity Health of New England. Thanks to the Connecticut National Guard. And thanks, of course, to Governor Lamont and to the governor's entire team. Josh Jabal, Michelle Gilman, Deirdre Difford, they have just been incredible partners throughout this effort, and I'm very, very grateful. I want to just start by saying, with Superintendent's leadership and with the commitment of our teachers and our paraprofessionals and our staff, Hartford Public Schools has kept some level of in-person school from day one of this school year. Going fully in person with a fully in-person option through mid-November and hybrid until this week, and then opening this week. And I want to start with that to say that our teachers and our paraprofessionals and all of our school staff deserve our enormous thanks, because they've been willing to come in and teach even before this vaccine was available. They came in this week with the announcement that we were going to be fully in person, even before we knew that a mass vaccination effort like this would be possible. But we owe it to them to get them vaccinated as quickly as we can. And the vaccination of school staff is a critical part of making a full return to school possible. As the superintendent said, school has changed dramatically, and it has been profoundly disruptive for thousands, tens of thousands of kids across the state, thousands of kids here, and we need to return to full school as quickly as possible. This is how we do it. And that's why the governor stepped up and his team stepped up to make sure that they were committing the vaccination supply that made an initiative like this possible. The other thing that makes this possible is having extraordinary partners. We're lucky in this city to have two extraordinary hospital systems, and I'm so grateful to St. Francis and Trinity for operating this clinic today. Vaccinating 1,500 school team members over these 2 days. That's a big undertaking. It's critically important, and I cannot say enough how grateful we are as a city. So again, to the team here at the hospital, Governor, to you and your team for acting quickly and with such partnership to make these vaccinations available in a dedicated way to our school staff, and to all of the team at the Hartford Public Schools who have been working their hearts out and showing up and teaching in new ways, in creative ways, including still in the classroom all year long. We're so glad to have this chance to get you in here, get you protected. Thank you, everybody. I missed an important part of my duty. I said my thanks, but let me introduce the governor. And again, the governor and I saw each other about a week ago at another press conference, and we were talking afterwards, and we both said, let's move as quickly as we can to get teachers vaccinated. And the governor was quick to act on that conversation, true to his word, and his team carried that out with incredible partnership. So, Governor, thank you for everything you're doing, and over to you.
All right, thanks, Luke. Hey, good morning, everybody. You're right, Luke. We said we're going to make this an absolute priority. And you want to know why? Our teachers made the kids a priority going back to September and before. And now we're making our teachers, our paras, the nurses, the food service workers, guys that drive the bus, custodians, all of whom have gone out there every day since September and made sure our kids had the best opportunity, either in person or remotely. And it was just really magic yesterday to have the First Lady here with the Secretary of Education, Miguel Cardona, celebrating the fact that Connecticut is one of those states where we've had 99% of our schools open for in-person learning. Most of them for full-time. I really salute, Leslie, what you're doing here. Hartford doing everything we can to convince parents it's safe to bring their kids back to this school. In-person learning, there's no alternative. It's going to take some time for some people, but that's what it takes. And I really want to say to Reg and Thomas and St. Francis Hospital, thank you. It's amazing what you've been able to do. 750 educators today, 750 educators tomorrow. We're getting our state back on its feet again. And one cranky guy with the megaphone does not deny the fact that this is a great day for Connecticut. Thank you.
Thank you, Governor. Thank you, Mayor. Thank you, Dr. Torres, Rodriguez. That concludes our formal program. We'll be happy to take any brief questions at this time.
Go ahead, Luke.
So let me just say, first of all, we've got about 2,800 school staff, teachers, paras, other school members of the schools, the Hartford Public Schools team. So this effort is going to be a two-phased effort. It's today and tomorrow, and then it will be a next round. The child care providers in those learning hubs that we set up will be in that next round. We don't have the date yet, but we're, I think, all committed to moving as quickly as possible to make sure that every single one of those folks gets the vaccine as quickly as we can. And, you know, obviously, as I said, the governor and his team worked extraordinarily fast to make this large allocation and dedicated allocation of vaccines available. We're still in a world where, you know, the supply of vaccine is, to a large extent, the limiting factor. But I think they're equally committed to making that supply available for the next round.
Yeah, so the Johnson & Johnson vaccine really was a blessing to the state of Connecticut. One of the things that we're working on diligently is to get the message out that it is not an inferior vaccine. So that has been a narrative in many of the conversations that we're having with the community. But it's important that we say loud and clear that although the efficacy is said to be about 85% for severe disease, we have to remember that it was compared to the variants or the mutations as opposed to the Pfizer and Moderna. So I would suggest to people, and I say this in my conversation, that if the Pfizer Moderna vaccines were tested against the variants, they too would probably be somewhere around 85%. So it's great. It's a one-time, as you know, injection. That one inoculation after about 28 days should give you the adequate immunity, and it will allow us as a state to go faster to reaching herd immunity, which is what we want, so that we can remove our masks, relieve the social distancing, and get back to some degree of normalcy.
Governor, can you talk a little bit about, I know we're specifically talking about trying to get more and more vaccines distributed to the states. Can you talk a little bit about when you think supply will exceed demand here in the states?
When will supply exceed demand? I have a feeling in a couple of months. We're seeing from the President, Jeff Zients, and the task force that the number of vaccines we're getting are ramping up quite a bit. Remember just a month ago we were getting 50,000, and last week we had 150,000. Not enough, as Luke Broden will tell you. We've got a lot of people lined up who would love to get vaccinated sooner. But right now we're going to have it'll be open to everybody within a couple of months, and maybe sooner than that, depending on the vaccine supply.
We know May 3rd is supposed to be the day, I think, for the youngest group to be able to get the vaccine. When do you expect, even with that, maybe to reach herd immunity?
Well, Reg is probably better able to answer that. Obviously, Dr. Fauci thinks it's 80%, but at some point over the course of the next couple of months, it's not going to be a matter of just making sure we have enough vaccines. It's making sure we have all of our populations ready and able to get vaccinated. And there are a number of underserved populations. Reg and I have talked about this a lot. We got to make an extra special effort to make sure that they realize it's safe, effective, the right thing to do for them, and the right thing to do for their family.
Which vaccine is being administered today?
Yeah, today we're administering the Pfizer vaccine today.
Did people ask? Did they care?
They asked, but they have no preference, which is preferred.
Yeah.
Governor, a little bit off topic, just real quick. Are there any plans to ease off of lessening pandemic restrictions due to White House pressure?
No, we'll be talking about the next phase of reopening protocols, this afternoon at 4 o'clock.
Okay, so no recent impact of comments made by the Biden administration on how they might keep restrictions.
We're not going to be like Mississippi and Texas.
Thank you.
Hey, thanks, everybody.